Good morning, students. The pathology of gastrointestinal tract is a very large topic, so we will be discussing it in a series of lectures. The first lecture is pathology of esophageal diseases, a quick synopsis. We will be discussing the topics that are most important from MCQ point of view. So we will be discussing in this lecture esophageal webs, Plummer-Vinson syndrome, achalasia, esophagitis, esophageal tear, gastroesophageal reflux disease, Barrett's esophagus, and esophageal carcinoma. So what is esophagus? Esophagus is the food pipe that carries the food that we eat from the mouth to the stomach, where it is digested. The esophagus is lined by stratified squamous epithelium normally, and it has a submucosa along with beneath that there is the adventitia, also the muscularis. So Plummer-Vinson syndrome is characterized by all except A. glossitis, B. esophageal webs, C. megaloblastic anemia, and D. esophageal dysphagia. The answer to this question is megaloblastic anemia. So what is Plummer-Vinson syndrome? Plummer-Vinson syndrome is also called as Patterson-Brown-Kelly syndrome. This syndrome is associated with iron deficiency anemia, it occurs usually in women more than 40 years of age. The typical feature is formation of esophageal webs. What are esophageal webs? These are ledge-like projections that occur from the mucosa, and these can cause partial obstruction of the esophagus. So as a result, there is formation of esophageal webs. This can lead to dysphagia. What is dysphagia? Dysphagia is difficulty in swallowing food. Dysphagia, difficulty in swallowing food. So Patterson-Brown-Kelly syndrome or Plummer-Vinson syndrome is associated with iron deficiency anemia, and in women more than 40 years of age, there is formation of esophageal webs which leads to dysphagia. Also there is glossitis and cheilosis. So what is glossitis? There is inflammation of the tongue, and cheilosis at the corners of the mouth there can be cracking, that is called as cheilosis. So if we discuss the question now that we just went through, the Plummer-Vinson syndrome is characterized by all except, now I think you will be able to crack it, glossitis, esophageal webs and esophageal dysphagia all are seen. But megaloblastic anemia is not seen because Plummer-Vinson syndrome is associated with iron deficiency anemia. Coming to achalasia. So what is achalasia? Achalasia is a condition in which there is increase in the lower esophageal sphincter tone. So esophagus has two sphincters, the upper esophageal sphincter and the lower esophageal sphincter. In achalasia, there is increase in tone of the lower esophageal sphincter. There is incomplete relaxation of the lower esophageal sphincter. So as the food passes from the esophagus to stomach, there is incomplete relaxation of the lower esophageal sphincter, and there is increase in tone of the lower esophageal sphincter. As a result, the esophagus can become dilated and there can also be dysphagia. Now, why does it occur? It occurs because of degeneration of the inhibitory neuronal ganglions. So the inhibitory stimulation to the normal tone is not there, it is reduced. As a result, there is incomplete relaxation. So that leads to achalasia, also known as achalasia cardia. So either this achalasia can be primary, or in some instances it can be secondary achalasia. So the most important example of secondary achalasia is the Chagas disease. Chagas disease is a disease which is caused by Trypanosoma cruzi. So this is again an MCQ. So all these are important points from MCQ point of view. Esophageal tear. So what is a Mallory Weiss tear? In cases of acute alcohol intoxication, the patient can undergo Mallory Weiss tear. So what is a Mallory Weiss tear? This is an important MCQ. So Mallory Weiss tear is a longitudinal tear at the gastroesophageal junction. So longitudinal tear at the gastroesophageal junction, that is called as Mallory Weiss tear. So this can lead to pain, it can lead to vomiting and hematemesis. So why is it caused? In case of severe vomiting or severe retching, there can be a tear. This vomiting and retching can be precipitated by acute alcohol intoxication. So Mallory Weiss tear is associated with acute alcohol intoxication, severe vomiting or retching, and there is tear which is a longitudinal tear at the gastroesophageal junction. This tear can lead to bleeding and pain, that is hematemesis. Sometimes this tear can be transmural, that is through and through, in which case it is called as Bohrov syndrome. So Bohrov syndrome is a syndrome in which the esophageal tear is transmural. So there is rupture of esophagus. As a result, the food and the bleeding can be in the mediastinum, which leads to mediastinitis. And there can be sepsis and shock. So Bohrov syndrome is transmural rupture of the esophagus and it can lead to mediastinitis and shock. This is again an important MCQ. Coming to esophagitis. Now esophagitis is inflammation of the esophagus. So whenever we add itis to any term, it means inflammation in pathology. So esophagitis is inflammation of the esophagus. This inflammation can either be chemical, in which case it is called as chemical esophagitis, or it can be because of infection, where it is called as infectious esophagitis. Now, chemical esophagitis can occur because of ingestion of very hot liquids. So, for example, drinking very hot tea or very hot coffee can lead to chemical esophagitis. Other causes include ingestion of caustic, alkali or acid ingestion, such as in suicide attempt. So, acid or alkali ingestion. Also, alcohol and smoking. These can lead to esophagitis. What is pill esophagitis? So when the medicinal pills that we swallow are dissolved within the esophagus before going into the stomach, they can get impacted there and they can cause inflammation, which is called as pill esophagitis. So chemical esophagitis can lead to pain, that is odynophagia, pain during swallowing. It can lead to chest pain. There can be hematemesis, vomiting. So all these can occur. And eventually, there can be stenosis of the esophagus. There can be stricture formation. There can be perforation rarely. Infectious esophagitis. What is the most common cause of infectious esophagitis? It is herpes simplex virus. So this is an MCQ. The most common cause of infectious esophagitis is herpes simplex virus. In immunocompromised patients, other viruses can also lead to infectious esophagitis. Such as, apart from herpes simplex virus, cytomegalovirus is another cause. Then the esophagitis can be fungal, such as candidiasis. So all these can lead to infectious esophagitis. Now in herpes simplex virus, there are punched out ulcers and the cells that are present at the margin of the ulcer show viral inclusions or viral cytopathic effects such as multinucleation, molding, margination. So viral inclusions can be seen. So another MCQ is, from where do we need to biopsy a ulcer? That is from the margin of the herpes simplex virus ulcer. We need to biopsy so that we see the viral inclusions. In cytomegalovirus, we see nuclear and cytoplasmic inclusions. Reflux esophagitis. So what is reflux esophagitis? Whenever there is a reflux, that is a backflow of the gastric acidic contents, it can lead to damage of the esophageal mucosa. This is called as reflux esophagitis. So why does it occur? Because of decrease in the relaxation of the lower esophageal sphincter. So transient relaxation of the lower esophageal sphincter. This can lead to reflux esophagitis and eventually it can lead to gastroesophageal reflux disease. So there is a backflow of the or reflux of the gastric acidic contents. And there is reflux esophagitis. Now this transient increase in relaxation of the lower esophageal sphincter can occur because of vagal tone, such as in alcohol, CNS depressants, in pregnancy. All these causes can lead to decrease in parasympathetic tone, and as a result there is relaxation of the lower esophageal sphincter. So all of the following are true about Barrett's esophagus except A. More incidence of squamous cell carcinoma, B. Metaplasia, C. Columnar epithelium, and D. Involves lower esophagus. So for this question we need to know what is Barrett's esophagus. So Barrett's esophagus occurs in patients with chronic gastroesophageal reflux disease. So, long-standing gastroesophageal reflux disease can give rise to Barrett's esophagus. It occurs in around 10% of patients suffering from long-standing GERD. Now, what is the characteristic feature of Barrett's esophagus and why is it so important? The characteristic feature is the columnar metaplasia. Also, there is intestinal metaplasia. So, columnar or intestinal metaplasia is the characteristic feature of the Barrett's esophagus. It is important because it is a precancerous condition. So, long-standing Barrett's esophagus can give rise to dysplasia and eventually it can give rise to adenocarcinoma. So, now I hope you will be able to crack this question. So, Barrett's esophagus is associated with metaplasia, it is associated with columnar epithelium and it involves the lower esophagus, but the incidence of squamous cell carcinoma is not increased. On the contrary, the adenocarcinoma incidence is increased as it is a pre-neoplastic condition. So, the answer will be A. So, just to explain to you, this is the normal esophageal lining. So, this is the squamous epithelium of the esophagus followed by submucosa and the muscular layer and there is adventitia. Now, whenever in the lower esophagus there is a reflux of the gastric contents, there is injury to the esophageal mucosa and there is metaplasia which is columnar metaplasia, intestinal metaplasia. So, we see goblet cells. These goblet cells are characteristic of Barrett's esophagus. So, columnar metaplasia or intestinal metaplasia are the words that you are looking for when you talk about Barrett's. So, this Barrett's can eventually give rise to dysplasia and adenocarcinoma. So, esophageal cancer. What is the most common type of esophageal cancer? This is an MCQ. The most common type of esophageal cancer is squamous cell carcinoma. And the other type is adenocarcinoma. So, squamous cell carcinoma occurs in conditions such as tylosis palmaris, where there is fibrosis of the fascia of the palm, achalasia, Plummer-Vinson syndrome, so these syndromes are associated with increased incidence of squamous cell carcinoma. This is again an MCQ. Also, ingestion of caustics, very hot liquids, alcohol, tobacco. And the pre-neoplastic lesion here is squamous dysplasia. So, HPV infection is another cause where there can be a squamous dysplasia and increased incidence of squamous cell carcinoma. So, you need to remember these, that is tylosis, achalasia, Plummer-Vinson syndrome, caustics, very hot liquids, alcohol and tobacco. Adenocarcinoma. Adenocarcinoma can occur in a background of Barrett's esophagus. So, Barrett's esophagus, intestinal metaplasia and dysplasia can eventually give rise to adenocarcinoma. carcinoma. Most common site of CA esophagus. For this, you need to know what are the sites of the squamous and the adenocarcinoma. So, the most common site of squamous carcinoma is the middle third of esophagus, and the most common site of adenocarcinoma, as you can understand, it occurs in a background of the Barrett's esophagus. So, Barrett's occurs in the lower esophagus because that area is the most prone to injury because of gastric reflux. So, that is why the adenocarcinoma occurs most frequently in the lower third of the esophagus. So, most common CA of esophagus is squamous cell carcinoma, we've already read. So, the most common site is the middle third. So, answer to this question is middle third. Most common site of CA esophagus is the middle third. So, squamous cell carcinoma occurs most commonly in the middle 1/3 of esophagus. And adenocarcinoma occurs in the lower 1/3. Coming to the summary of this short lecture. So, esophageal webs are the ledge-like projections from the mucosa. These can occur in the Plummer-Vinson syndrome. This syndrome is associated with females who are usually more than 40 years of age. There is iron deficiency anemia. There can be esophageal webs which can lead to dysphagia. Along with that, there can be glossitis and chillosis. Also, it is associated with increased risk of malignancy of the esophagus. Achalasia is again a condition which can be related to increase in incidence of squamous cell carcinoma of the esophagus. In achalasia, there is increase in the tone of lower esophageal sphincter which occurs because of degeneration of the neuronal cells, the inhibitory ganglions. It can be either primary or secondary, for example, in Chagas disease, that is Trypanosoma cruzi. Then esophagitis, it can either be chemical in nature or infectious in nature. The chemical esophagitis occurs because of either ingestion of very hot liquids or because of caustic alkalis or acid ingestion. These can lead to chemical esophagitis, or it can also be caused because of pill esophagitis where the medicinal pills get dissolved within the esophagus. The most common cause of infectious esophagitis is herpes simplex virus. Esophageal tear occur in Mallory-Weiss syndrome which occurs because of severe retching and vomiting associated with acute alcohol intoxication. Whenever the tear is transmural, that is, there is rupture through and through, it is known as Bohrav syndrome. The Mallory-Weiss tears characteristically occurs in the gastroesophageal junction. It is a longitudinal tear. Bohrav syndrome is through and through rupture of the esophagus, and it can be related to, it can lead to mediastinitis and severe shock to the patient. Gastroesophageal reflux disease or reflux esophagitis occurs because of the reflux of the gastric acidic contents, and eventually it can lead to Barrett's esophagus, that is the columnar metaplasia of the lower esophagus. The Barrett's esophagus is a background in which the dysplasias and eventually adenocarcinoma of the esophagus can arise. The most common esophageal carcinoma is a squamous cell carcinoma. It occurs in the middle 1/3 of the esophagus, and adenocarcinomas of the esophagus can occur in the lower 1/3 of the esophagus. Thank you very much for listening.